Welcome. In this short video, we will talk about different healthcare systems and different health outcomes with particular focus on Central Eastern European countries. There are many ways, and among them international surveys, to measure the performance of healthcare systems. One of these is the Euro Health Consumer Index, which comprises 35 European countries and assesses their healthcare system performance along 46 indicators grouped into 6 dimensions: patient rights, accessibility, outcomes, range and reach of services provided, prevention, and pharmaceuticals. Each country is calculated a score in each dimension, and these dimension scores are aggregated into overall scores. Healthcare system performance can be green, yellow, and red based on the overall score achieved by the country. As you can see in the chart on the right of this slide, most Central European countries are red, or in some cases yellow, but not green. It can also be seen that green countries are typically located in Scandinavia and Western Europe. The left part of this slide shows the full ranking of the 35 assessed countries in 2017. The Netherlands have the highest overall score, 924 points out of a maximum of 1,000, closely followed by Switzerland, Denmark, and Norway. So, as is mentioned before, you can see that in this survey, the Scandinavian countries perform very well. In general, the lowest performers were Central and Eastern European countries. 5 of the 9 CEE countries finished in the lowest quarter, 25% in this survey. On the right side of this slide, the table contains the rankings of the CEE countries in 2017 compared to 2016, showing that only a few Central Eastern European countries were able to improve their ranking position. Let's have a closer look at the health outcomes dimension. There are many indicators in this dimension, among others, infant deaths, cancer survival, fatality for acute myocardial infarctions and stroke, patient years of life lost, etc. Each indicator is assessed individually. Then the achieved scores are aggregated into an overall score of this dimension. On this chart, you can see the changes of the overall outcomes scores in the CEE region. As you can see, basically there is no improvement at all. Only Slovakia was able to increase the efficacy of its healthcare system. All the other countries of Central Europe achieved lower or nearly similar points in the outcomes dimension in 2017 compared to 2016. You can observe that in the case of the countries which achieved higher points in 2016, the outcome scores dropped more significantly. For example, a 20% decrease in the case of Slovenia, while in countries with very low scores in 2016, the scores seemed to be stagnant. The reason of their stagnant and not declining trend could be the fact that Serbia, Hungary, Bulgaria, and Romania achieved such low overall scores in 2016 that they could not lose many more points in 2017. It is often asked if healthcare investments can be linked with healthcare outcomes. Based on the Euro Health Consumer Index survey, the answer is yes. This correlation is illustrated in this slide. The map on the left of this slide shows the performance of the assessed countries in the outcomes dimension. As you may note, the color patterns are similar to the colors of the map which showed the overall scores. However, there are some differences. Some countries with yellow overall performance offer green outcomes to their citizens, like Portugal and Sweden. However, other yellow countries, typically from Central and Eastern Europe, like Croatia and Serbia, have scored red in outcomes. This means that the healthcare system is not really able to convert efforts and interventions into tangible results. In such cases, there may be organizational issues in the background. The chart on the right side of this slide shows the correlation between per capita total healthcare expenditure expressed in US dollars and charted on the horizontal axis, and health outcomes scores charted on the vertical axis. Blue dots are individual countries, and the CEE countries are marked with a red color. The countries of the CEE region are located at the left bottom of the chart, which means that the low investments into healthcare result in low health outcomes in these countries. The relationship is clear. The more a society invests into healthcare, the better health outcomes it can expect. If you would like to see real-life-based evidence on the positive effects of the higher investment into healthcare, look at this chart. On the vertical axis, you can see the healthcare expenditure per capita, while on the horizontal axis, there are the cancer-induced mortality to incidence ratios in the case of many European countries. This figure shows us an example of the efficacy increment driven by additional investments into healthcare. In countries where healthcare expenditure per capita is higher, the cancer-induced mortality rates are lower. These countries are typically the Scandinavian countries marked with a green triangle, or the Western European countries marked with a blue circle. In general, you can see that the mortality rates are the highest in the CEE region marked with a red square, where the healthcare expenditure per capita is the lowest. This correlation confirms that investment into healthcare does result in better health outcomes. Let's focus for a second on GDP growth in the Central European region. Take a look at this chart. It shows that per capita GDP has been following a stagnant trend in most countries. At the top of this chart, you can also see the average EU per capita GDP. This is still much higher, and Central Europe has still a long way to go to catch up with the EU average. Now, let's jump to the interesting part. Data from the World Health Organization Health for All database. These columns show healthcare expenditure as a percentage of GDP for 9 Central European countries: Bulgaria, Croatia, Czech Republic, Hungary, Poland, Romania, Serbia, Slovakia, and Slovenia. You can also find here, on the right, the Central European average and the European Union average. You will have noticed that healthcare expenditure as a share of GDP has been decreasing or stagnated in all the countries shown in this chart, except for Bulgaria and Serbia, where healthcare expenditure seems to have followed or even slightly exceeded economic growth. Now, look at the green parts of the columns. These show that part of healthcare expenditure which is paid for by governments and public bodies, this is called public healthcare expenditure. You can see that public healthcare expenditure constitutes most of healthcare expenditure in the region. This is certainly positive. On the other hand, the gray parts, which show private expenditure on healthcare, are quite significant too. You will also have noted that public healthcare expenditure has not followed GDP growth either. This reflects the fact that governments in Central Europe do not prioritize healthcare investments on the political agenda. Finally, look at the right of the chart. The arrow illustrates the difference between the Central European average and the average of the whole European Union. There seems to be an approximate 2% difference in the share of healthcare expenditures from GDP. If you remember that healthcare investments correlate with better health outcomes, this 2% is a significant difference impacting health outcomes. Waiting lists are often mentioned as key performance indicators from a patient perspective. Actually, waiting lists cause problems across all of Europe, and it would not be appropriate to say that they are only a problem of Central and Eastern Europe. Ireland, the UK, Sweden, Romania, and Spain are all red as regards to waiting lists. The Euro Health Consumer Index has also pointed out that there is no correlation between per capita healthcare spending and waiting time. Rather, waiting times seem to be more associated with demand control and some probably outdated health policies. Let's take a look on inpatient care and hospital capacity. On this slide, this figure shows the number of hospital beds per 1,000 inhabitants charted on the vertical axis in relation to the average number of days spent by a patient in hospital charted on the horizontal axis. Let's first look at the dashed line. The line means that there is a correlation between these two factors. In other words, the increment of the average duration of hospital care increases the average required number of hospital beds, which in fact makes the inpatient care system more expensive. The countries in the CEE region marked red are typically above this dashed line. Therefore, they run their inpatient care system more expensively due to the bigger hospital capacities. The countries in the upper right corner, like Poland, do not only run their inpatient care system more expensively, but also with less efficiency, as a patient spends more time in the hospital than the average. In contrast, in cases of the countries in the upper left corner, such as Hungary, a patient spends an average time in hospital. Nonetheless, the inpatient care system requires more beds than the average. This means that in these countries, a higher proportion of patients are hospitalized, which is due to the fact that the patient pathways in Hungary are not appropriately managed. The outpatient parts of the healthcare systems seem to not work efficiently, which increases the hospital admission rates. In conclusion, the fact that the inpatient care systems of CEE countries are being run with more beds does not result in better care. Rather, it results in a more expensive healthcare system, which is a question about whether the CEE region can afford it. Investments into healthcare can come from public funds, generally some type of national health insurance fund, as well as private enterprise, organizations, private insurance companies, households, and also from the patients themselves. The term of out-of-pocket payments, OOPs, refers to direct payments made by healthcare providers, hospitals, clinics, manufacturers, etc., for the health service. On this slide, we can see the latest data about the proportion of the out-of-pocket health expenditures of the total health expenditures in the CEE region. Generally, the proportion of OOP payments is lower in Western European countries, for example 6.8% in France, and higher in developing countries, for example 67% in India. As you can see, only Slovenia, the Czech Republic, and Croatia have a lower proportion than the EU average. All the other countries have higher values. In fact, the proportions of Serbia and Bulgaria are multiple times higher than the EU average. This may refer to high co-payments in some Central European countries, or it may show that some services which people regularly use are not publicly funded in the region. Another reason behind it could be that the patients are trying to close the gaps between the differences in the efficacy of the healthcare systems by themselves via OOP payments. As the different classes of the society can afford different private healthcare services, the high OOP proportion can also lead to differences in general health. In conclusion, let's take a look at a wider perspective of health. On this slide, you can see the expectancy at birth in case of the OECD countries. The top performers are also from Western Europe and the Scandinavian area. The results confirm that better healthcare systems generally offer better health perspectives for citizens. This is true even though life expectancy is clearly correlated with factors which are outside the healthcare system, such as lifestyle and the role of the broader social net on which people can rely for support and help. These factors are likely to play a significant role in Southern Europe. Let us conclude that there are many differences in the operation of healthcare systems, and these differences can lead to different outcomes from a patient perspective. In general, unfortunately, a patient can expect significantly worse outcomes in the CEE region than in Western Europe or in the Scandinavian area. This can be traced back to a number of reasons, but most importantly, due to less investment with less efficacy into healthcare. In order to increase the efficacy level of healthcare in the CEE region, healthcare politics should pursue efficient investment and organizational efforts.